Hi, my name is Katoria and I'm going to be your guide through this poster presentation. Today we'll be learning about the powerful combination of imaging and machine learning. These two tools come together to help us understand life in the margins, or what aggressive papillary thyroid carcinoma looks like. Using this information, we can help reduce the recurrence of these tumors. Primary therapy for papillary thyroid carcinoma, or PTC, is removal of the tumor. But more than 1 in 10 cases reoccur due to partial resection. And of these cases, nearly 40% of patients die as a result. So how can we prevent this reoccurrence? Well, we have to detect the true tumor margin, because the tumor may be metastasizing or expanding outside of this margin, which makes it difficult to get the entire tumor. So if you look in the top left, you see a RGB or a plain image and a map of the tumor in a normal margin of that particular resected tissue. It is not obvious where the tumor in the normal tissue is, therefore the physician cannot easily determine where the boundaries are. Our solution is to employ hyperspectral imaging, or HSI, in combination with radiomics to identify aggressive tumors so we can stop the metastasis early. And HSI is a process of obtaining a spectrum of image information rather than standard red, green, and blue color channels. Radiomics is a calculation of image textural and shape-based features. Using these tools, we can obtain HSI, differentiate aggressive and non-aggressive tumors, and develop a machine learning software to classify these tumors in real time. For this method, we used a total of 44 patients with 72 corresponding specimens. We imaged these using the CRI Maestro HS system, classified these tumors according to the American Thyroid Association 2015 risk stratification system, extracted features using Radiomics within Python for a total of 120 features, and classified using machine learning algorithms provided by scikit-learn in Python. Our results were a maximum of 83% accuracy. There were a total of 3 methods that produced this. One thing I want to point out is that they all used a different number of features, although they all had the same accuracy. And the machine learning classification tool, quadratic discriminant analysis, had a false negative rate of 0 in both cases, meaning that it never classified an aggressive tumor as non-aggressive, so it was conservative in that regard. Finally, I like to point your attention to these graphs. It's difficult to see here, but the takeaway is that aggressive tumor tissue and non-aggressive tumor tissue have an intrinsic variance in them that were significantly different. So we can find that if we have these two tissue types and we calculate the variance of them, they are significantly different, and we can use that to identify the different tissues. So in conclusion, we were able to obtain HSI of the fresh tissue papillary thyroid carcinoma, and we effectively got 83% accuracy using our methods here. In the future, of course, with any machine learning, more data would be required in order to improve the results. We could also implement tumor grading, meaning non-aggressive or low-risk carcinoma, high-risk carcinoma, things like that. And then finally, implementing some kind of data augmentation to improve our results further. Thank you so much for listening.